Hello everyone! After a couple of video sessions, here we are again. As usual, this is Jacob John and today with me is
Ruth.
Together, we're going to perform another role play. And in this particular role play, Ruth is going to be a mother, particularly a nursing mother. And I'm going to be a staff nurse who is going to solve all her problems pertaining to nurse a child. Let's see how this role play is gonna get over. Good morning, Rachel.
Good morning.
How are you doing today?
I'm okay.
It seems like you're not okay. I can see a little bit of anxiety on your face. And apart from that, your baby girl is crying. Could you please tell me what's the reason?
Nurse Jacob, I'm having some trouble with breastfeeding.
Oh, all right. And I think your child is 7 days old.
Yes.
Since when did you start having this particular problem?
From last 2 days, I'm having this problem. I have this sore nipple
Alright.
and my breast is also swollen. I'm having a little bit pain as well.
All right, so please don't worry. You want to calm down and relax. Would you like to have a glass of water? I'm just going to ask you a couple of questions. I hope you don't mind.
Yes, you can ask.
All right, first of all, I want you to be in a comfortable position. Would you like to recline? Would you like to sit straight?
No, I'm fine.
Okay, and your baby is fine in the cradle, isn't it?
Yes.
All right, fine. Rachel, I want to ask you questions, starting with how often do you feed your baby? Could you please just tell me?
The doctor did said that I have to feed her every 2 hours, I guess.
All right, every 2 hours. Wonderful. Yes. And are you following that? Particularly
Yes,
you
I am.
are, isn't
Yes,
it? Yes. And when did you first started noticing you're having some problems regarding your breast? And if you don't mind, can I please assess your breast?
Yes.
Thank you so much, Ruth, for letting me assess your breast. It seems like your right breast is a little bit swollen than the left. So, do you often feed simultaneously both the breast?
No, I don't think so.
Oh, right, and that could be one of the reasons that the right breast is much more swollen because it is laden with milk, I guess so. And what particularly are you experiencing? Could you please tell me the inconveniences that you're experiencing pertaining to your breast?
I'm having this pain.
All right.
throbbing
And
pain.
when I was assessing your breast, could you please tell me how did it feel? Like, was it tender for you, or was it painful, or was it because I felt a little bit of warmth and it was unusual, I think. Did you experience a spike in temperature or anything last night?
No.
All right, and yeah, the right breast was a little bit heavy, so it seems like you did not express the milk also. I do remember I told you about expressing the milk just in case if the baby is not able to suck properly.
Okay. I did
Okay,
not.
all right, don't worry about it. I'll be giving you an extractor. I'll teach you how to express the milk, and with which you can store the breast milk in room temperature. And sometimes if it is necessary and if your baby is not taking the feed, you can just keep it in the refrigerator. And when the baby is about to feed, or when the baby is about to take the milk, you can take the milk out of the refrigerator within a stipulated time period, not more than that. You can keep it in the room temperature, and then you can start feeding your child again.
Okay.
All right. So I'm going to ask you something else. How long has it been that you taken a shower? I hope you're taking shower every day, isn't
Yes, I
it?
am. Yes, I am.
All right. So when you were taking a shower, what particularly did you notice about your breast?
That my breast was swollen and milk was a little bit oozing out as well.
All right. And could you please tell me, was there any bloody discharge?
No.
There wasn't any bloody discharge. And comparatively, you're comfortable feeding your left breast, it seems, isn't it?
Yes, but whenever the baby sucks the nipple, I'm having this pain as well there.
All right. Don't worry about it. I'll be explaining to you. Could you please just tell me a little bit about how do you keep your baby onto your breast that we do call as a latching on technique? How do you place the baby's lip on the nipple? Exactly. I think I have taught you that as well. Do you remember?
You did taught me.
Yes.
But,
You forgot. Don't worry about it. First of all, you have to hold your baby in a comfortable position. Sometimes, if you're like feeding your right breast or your left breast, you can just interlace your arm like this. You can make an L position of your elbow and keep the baby's head on your elbow, isn't it?
Okay.
And then you can slowly insert your small finger into the mouth of your baby and then place your nipple into the baby's mouth. And just to see whether there's any vacuum or whether there's any space, you can again rotate, but make sure that your fingers are clean and your nails are trimmed, just to avoid any unknown injury, accidental injury. I suppose you understood what I meant.
Yes.
Is there anything else that you would like to ask me? And also want to tell you something else. Whenever your baby is sucking, what exactly you have to do is you also have to apply a little bit of pressure on your breast so that the milk can freely flow. And make sure that after feeding your baby, keep the baby onto your shoulders just to let her burp. It will be much better than to avoid any sort of a gagging or any sort of aspiration. I've explained it to you earlier, but no worries. I know that you're a little bit anxious right now since you're having this particular condition.
Okay.
Yes. Is there anything else that you would like? Still, I can see a little bit of anxiety on your face, so I don't want to trouble you more. I'm just going to have a look at the other patients as well. Your baby was crying, so just thought that I'd just pay a visit inside.
There's one more thing, nurse. My nipples are cracked, so I want to ask if there is any medications available for it.
Oh yes, that's actually a wonderful question, and most of the nursing mothers, they go through this particular phase. So what I would like to advise is whenever you're taking a shower, please don't use any sort of body washes or soaps. It'll be much better to make your skin dry. And after you feed your baby or before you feed your baby, just soak a towel in warm water or hot water. And after that, you can apply around, clean your breast and clean your nipple with that. And you can just feed. Do not apply any emollients or any sort of petroleum jelly. Just in case, if it is that much cracked, I advise you to apply virgin olive oil. It's really nice. But make sure that you clean it off before you feed your baby. You never know that any foreign particles or agents could actually cause some sort of irritation in your baby's stomach, isn't it?
Yes.
She's only 7 days old. I think everything I have made clear, isn't it?
Yes, you did.
Just in case if you have any sort of doubt, just in case if you have anything that you want to clarify, please feel free to ask. By the time I'll just take a round to the other patients, right? I'm just having that work also to do. And I hope you are comfortable right now.
Yes, I am.
So I would like you to start nursing your baby once again in front of me so that I can be rest assured that you're following what I have told you and taught you.
Okay. Thank you, Jacob.
Thank you so much, Rachel, to give me this particular chance to talk to you.